Welcome back. Welcome back to Empowerment Nursing. I'm Linda, and this is Ashley, and you are tuning into our series In the Know, where we make it simple. Today we are simplifying lab values.
Lab values in terms of your registration exam can range from simple recall questions in terms of knowing the normal lab values to complex questions in terms of having a disease process and then being able to predict what a patient's lab value might be. So where do we get lab values from? First of all, let's just go back to that fundamental concept. So we can get a lab value from a lot of things in a patient, but today we're going to specify getting a lab value from a blood sample, so taking blood from a patient and sending that down to the lab, or in obtaining a urine sample, getting a urine sample from a patient and sending that down to the lab, where they will then send us back a measurement which will tell us whether or not that patient's lab value in their blood or in the urine falls within a normal range. And what's so important is not only knowing what that normal range is, but knowing what an abnormal range might be as a way of predicting a disease process within a patient. So we're going to do something right now on our iPad. We're going to draw a stairway for you that's going to help simplify this concept. It's a little bit of a trick that I definitely wish I'd have known sooner. So we're just going to draw a staircase, a simple picture, and I'm going to write here concentration equals climbing, and then an arrow pointing downwards, and dilution equals down. And what I mean by climbing or going down is that if a fluid is concentrated, the lab value will climb or be higher than normal. And if a solution is diluted, the lab value will go down or be lower than normal. So now Linda's gonna simplify concentration in terms of a little prop we have here.
So sitting in front of me, we have two bottles. One is concentrated and one is dilute. So we've added Kool-Aid to make this one concentrated, right? And this one has a low concentration of Kool-Aid, so it is dilute. So if we took a lab value from these bottles, from this Kool-Aid, this one would be concentrated, so you'd expect the lab value to climb or to be higher than normal, and this one would be dilute. So if we took a lab value from this Kool-Aid bottle, it would be lower because it is dilute, so you would expect the lab value to be lower than normal.
So how does this apply to a disease process in a patient? If we go back to that staircase, concentrated equals climbing, diluted equals down, let's talk about some disease processes where we can apply this knowledge critically in order to demonstrate how this is so useful. So say, for example, you're taking care of an elderly patient. The elderly patient keeps putting on the call bell to go to the bathroom, go to the bathroom, go to the bathroom. And every time you toilet the elderly patient, they void a tiny little bit of concentrated bright yellow urine. If you were to take a sample of that concentrated bright yellow urine and send that down to the lab, any lab value in that urine, because that urine is concentrated, would climb or be higher than normal, okay? Other disease processes such as diabetes insipidus. Diabetes insipidus causes, through the ADH hormone, rapid diureses. So the patient constantly has urinary output. If you are voiding out or peeing out your fluid, you are losing it from your bloodstream. So if I was voiding tons of fluid, my urine would be diluted. Any lab sample taken from my urine would be down. Diluted equals down, or lower than normal. If I'm diluting out all of my fluid, there would be an inverse relationship in my bloodstream. So my blood would be left concentrated because I'm voiding out all of my fluid. So if you were to take a blood sample from a diabetes insipidus patient, their blood would be concentrated, so any lab value in their blood would climb or be higher than normal, such as, for example, serum hematocrit, serum sodium levels, right? Now let's talk about the opposite. So syndrome of inappropriate antidiuretic hormone, that's a mouthful, or SIADH, is an inappropriate amount of antidiuretic hormone. Antidiuresis means we are retaining fluid. Inappropriate antidiuresis, we are retaining all of our fluid due to abnormal levels of ADH. So an SIADH patient retains all of their fluid. So if I'm retaining all of my fluid, my blood is diluted. If you take any lab value from my blood, it would be diluted and it would go down. So I would have lower than normal levels in my blood labs. So if I'm retaining all of my fluid, the opposite is true of my urinary output, right? So my urinary output, if I have SIADH, is going to be very concentrated. So if you take a lab value from my urine, it's going to be concentrated, so it's going to climb and be higher than normal. So this is how you take that information and apply that simple staircase, concentrated climbing, dilution equals down, to complex disease processes.
And so it's really important to know our labs, both in the urine and in the blood, because it directly relates to the dilution or the concentration of the urine in the blood, as demonstrated by our water bottles here. It allows us to predict and to anticipate lab values critically so that we can get to the correct answer on the registration exam.
So let's not forget that it might not just be knowing what a normal serum sodium is. It might be your patient has diabetes insipidus. Which of the following lab values might you anticipate? Then you're going to think diabetes insipidus, losing fluid from the vascular space. You're going to think about that staircase, diluted equals down, climbing equals concentrated, and you will come to the right answer.
Thank you for joining us in the know. Please share this video with your nursing friends. For more in the know and for all concepts simplified for your registration exam, check out our complete study package. See you next time on In the Know.
Bye for now.
Bye for now.